In this video, we aim to show you how to search the non-insured health benefits drug benefit list. It can be a useful skill in order to find out whether a drug is covered or not. In the Google search bar, type in NIHB Express Scripts, hit enter. When you scroll through the results, you can see you have the main page for Express Scripts, or you can actually access the drug benefit list directly. Click on that. This brings you to the searchable database. Take a moment to read through the information here. Drug benefit list contains drugs that are included in the non-insured health benefit program, which are primarily used in a home or ambulatory setting. Physicians and pharmacists can also use this list to select the most optimal and cost-effective drug therapy. And the disclaimer, users of this site acknowledge that the information is a guide for informational purposes only. So if there's ever something that you do search and you don't find the results, or you find something that may not be covered, always double check with your pharmacist or your physician to make sure. But let's have an example where we are a person who is 56 years old and you are at risk of shingles due to the fact that you had chickenpox when you were a youngster. So you know that there's a vaccination available for shingles, and you decide to look up whether that particular drug is covered. So if we look up the name SHINGRIX, and it's important that you have the correct spelling of the drug or the drug name. So we type in Shingrix, we scroll and just hit search, scroll down, and we see that there is one record found. So we want to learn a little bit more about this. Typically, when you have a result that's listed, the drug is covered. But let's have a look at the details here to make sure. So here we have better details on the particular drug. Shingrix. Here it talks about the strength. Here it talks about the dosage form. This section here is called the clinical directives. And then down here is your coverage benefit status. So just some things to note. We can look at the strength. This is how much of the medication is within the drug dose. The dosage form is how that drug is administered. So this one is INJ, which means an injection or a needle. Other dosage forms could be tablets, capsules, suppositories, inhalers, oral liquids, etc. The other thing that you want to take note of is the coverage benefit. So these are all listed by province and territory. So we have Saskatchewan, Quebec, Prince Edward Island, Ontario. Here we see it is an open benefit. That typically means that the coverage does not require any prior approval. When it says limited use, that typically means that prior approval may be required. The other thing that you want to note, especially with this particular drug, Shingrix vaccine, is that it says here the coverage conditions. It is typically for clients 60 years of age and older. So for a person who does not fall within that age range, this drug is not covered. Now there are some things that you want to make sure of when using this drug benefit list, and we're going to show this in our next example here. So we're going to clear our search, and we're going to look up another drug. So as an older person, you have some minor aches and pains, headaches, backaches sometimes, and typically you take a over-the-counter pain reliever. The one that you choose to use is Aleve by the brand name Aleve. That's the brand name of the drug. So if we type Aleve in here, A-L-E-V-E, and again, noting to make sure that that drug name is spelled correctly, and we click search, we find that there are no records found. Now, when you look up the drug Aleve, so if we just do a quick search and type in Aleve, and this is going to give us a little bit more information here. So even here we can see that the drug that Aleve includes is called naproxen. That's the chemical name. So we can look here and type in naproxen under the chemical name, remove the word Aleve, click search, and when we scroll down we find that there are a number of records available. Different strengths, 250 milligram tablets, 125 milligram tablets, 500 milligram tablets. All of these drugs are covered. So these are the generic brands or the generic drugs that are available as a prescription. It's just not listed as Aleve, the brand name put out by the manufacturer. So this is one way where using that drug benefit list can be quite useful as a client looking to see whether a drug is covered or not. Do also be sure to use the Express Scripts Contact Us option if you ever have questions on whether a drug is covered. There's call centers. You can also contact the non-insured health benefits inquiry number as well. But this is the number that you would use for clients, 1-888-441-4777. Hope this is helpful. Enjoy your day.